for all of my ADA members out there, I don't know if you remember in 2024, they did a nice little dues decrease. They dropped it down. They were lowered by $30 in 2024 from 600 to 570. Well, hope you enjoyed that little holiday, as they are now proposing for the House of Delegates in October to increase the dues back to the $600 and also add a 3% increase on top of that. I know dues increases are always contentious, having been in organized industry for a really long time. That's always a really difficult conversation to have. This is going to be exponentially more difficult because it has become apparent over the last 8 months about some fiscal challenges that the ADA has had and maybe some misuse of those dollars. So there is definitely a marketing problem to be had with the dues increase. It will be really interesting to see how the House of Delegates handles this particular proposal and what, frankly, the leadership of the ADA will do to ensure that that extra revenue coming in will have good intention for spending. So I do think this definitely probably will be one of the must-sees House of Delegates. I'm actually somewhat tempted as an ADA member to grab a box of popcorn and attend myself in the peanut gallery just to be an observer. Okay, a couple of things also came out this week. Of course, the government currently shut down as of midnight tonight. We're still waiting to see exactly what that might actually mean. And I kind of laugh about that because I guess unless you work for the federal government or in some other capacity, today really meant nothing. It did not move the needle. I don't think on the government being shut down, I was able to get to work, do my job, treat patients, come home and run a podcast. So it'll be interesting to see what day 2 through 5 means for the US. But there were some other interesting news articles that came out this week. One most notoriously was the one from RFK and Trump on Tylenol and the connection with autism. This has been a very weird response. There's been a lot of weird things around this particular statement. I don't know if the science is true or not. I don't know yet. I don't think it's really clear. But I think the thing that bothered me the most as a clinician, let's just say Tylenol does cause autism in pregnancy, and coupled with other things like vaccines, there's really a toxic effect. Okay, let's just hypothesize that for a second. To say that, but then to provide clinicians with no help on how we're now to manage those patients is very counterproductive. So now, if a patient comes in to me and is pregnant and has legit infection, pain, other issues that we have to simultaneously manage while they're pregnant, because pregnancy doesn't just take a holiday for all other oral health conditions, what are dentists and physicians supposed to do for pain management? So regardless of how you feel about whether or not Tylenol has some correlation with autism or not, and hopefully the science will become more clear on what we should or should not be doing. When we make these grandiose statements, when the government comes out and gives all this deep prophetic knowledge, the very next statement should be a guideline for moving forward for doctors so we know how to take care of the people who depend on us to make decisions. The bottom line that has now been left to physicians and doctors and dentists is that you just use your best judgment. I actually don't know what that means anymore. I don't know if I just do my normal protocol or if now I'm really stuck between a rock and a hard place. And should I happen to recommend Tylenol to a pregnant patient who does end up with a child with autism, will I be sued? And ultimately, while we have the best intentions to take care of people, it's always in the back of the mind of physicians and dentists. Thank you for attending my TED Talk in a bit of a soapbox, but I really feel like it's okay to make these statements, but you really are, handcuffing the people who ultimately care for the folks to make decisions about how to take care of them moving forward. So I really hope, RFK, that is next on your agenda, is to give us some guidance on how we can continue to take care of people, whether we believe the science or not. Another couple interesting story articles that came out. One, I think it's important to note there's been a pretty big campaign to remove some of the mental health questions that were required for licensure. Now 60 different licensure boards, as well as 18 over 1,800 different hospitals are participating in a program called Wellbeing First Champion Challenge. And this is to try to eliminate some of the stigma of mental health associated with different professions. So we'll see what that means. We think it should be fairly beneficial for dentists who want to pursue the profession and licensure, not to be stigmatized by past mental health issues. The last story, because I'm just full of Susie Ray sunshine tonight, is HPI, as you know, has been putting out data since 2020 on the status of dental health practices, and the general well-being of dentists in the US. Well, they came out with their most recent statistics. And I think the data is continuing to be pretty consistent. Definitely a tight fiscal squeeze for dental practices. The wait time for new patients to get into dental offices continues to go down, which I think says a lot about availability. You can interpret it two different ways, because at the same time, we're also seeing a constraint on getting in hygiene folks for staff. And that definitely continues to be very consistent in the data, is that most dentists are continuing to find challenges in bringing in dental staff members, particularly in the hygiene realm. But we had a pretty big peak of activity around the end of Q3, Q2 2023, 2024. And now we're just kind of seeing this continual precipitous drop of financial well-being of practices. I think I'm seeing it as well. So when I read this article, and it's at least refreshing to see that maybe you're not alone when you feel like September is now also translating to suck August and suck October. But we press on and we try to get more creative on the ways that we can make these fiscal responsibilities work. So with that, being as optimistic and what a ray of sunshine I have been tonight, that's the news.